Hello everyone, in this video we are going to study about the particulars of Lachesis, head, under the head, headache in drunkards with high blood pressure, location, left-sided headache, tendency to go right. As we read earlier, it is a left-sided remedy, so all the complaints will start from the left and they start going to the right except the lower limbs. So the headache also starts in the left side and they have a tendency to go to the right. Sensation, as if all the blood has gone towards the head. Character of headache, congestive type of headache, as if skull would burst. Character of pain, there is pressive and bursting pain in temples. The head is very much sensitive to touch. As the Lachesis patients are hypersensitive to touch, even the headache, there will be pressive and bursting pain in the temples, and the head also will be sensitive to touch. Modality, aggravation from motion, pressure, after sleep, amelioration by menstrual flow. Zincum met alium sipa. Same characters are found. The complaints will be ameliorated by the menstrual flow. Now let us see the respiratory complaints of Lachesis. Throat. Lachesis is indicated in tonsillitis and diphtheria. The location of the tonsillitis and diphtheria will also be on the left side and they extend to the right. Sensation, soreness, dryness and constriction in the throat. The look of the throat, dark purple appearance of a membrane. Throat seems as a large lump has settled over there. The person feels that a large lump is settled in his throat. Liquid is more painful than solid, which means it is very hard for people to drink water or take any sort of a liquid, but they can take the solids. It is much better, but the liquids are very painful. Same in ignitia and belladonna. When swallowing, throat is very much sensitive to touch. Prostration is ordered of all proportion to appearance of throat complaints. The liquids will be painful here and dark purple appearance of the membrane, and the person has a lump-like feeling in the throat. The modalities, aggravation is after sleep, from hot drink and from touch. Heart, there is violent palpitation, must sit up, very restless and trembling. There may be suffocation on lying down. Constrictive feeling in the chest with precordial pain. Here the complaints will aggravate when he is lying down, when he goes into the sleep. So with that fear of suffocation and the pain, the person does not sleep. There will be violent palpitations. It will force the patient to sit up. The patient will be very restless and trembling. Unable to lie on the left side with fainting and anxiety. It may also be associated with left-sided apoplexy. There is blueness and purple look of the body with collapsed condition with the cold sweat. The patient wants to be fanned but slowly and from a distance. Precordial region is very painful and sensitive to touch. So here the patient, the look of the body will be purple and blue. Bluish and purple color will be the look of the body. The person will have cold sweats. He cannot lie on the left side. There is fainting. There is anxiety when the person lies down. There is trembling which makes the patient sit up, and the patient has suffocation when he is lying down. The heart, there will be congestive sensation, constrictive sensation in the chest. And the fanning, the person wants from a far distance, and it should be on a low speed. Now let us see the epilepsy of Lachesis. Epilepsy results upon the loss of vital fluid, sexual excess, onanism or jealousy. It comes on only during sleep. Cupramet, Bufo, during waking hours, Agaricus muscaris. So guys, the convulsions in Lachesis, why does the convulsions happen? Whenever there is loss of the body fluid or there is onanism, sexual excess, jealousy, and the convulsions or the epilepsy comes only during sleep. Female genital organs, very important. Lachesis has a special affinity for female genital organs, especially left ovary. Since it is a left-sided remedy, Lachesis will affect the left ovary. It is causing the inflammation of glands, cellular tissue, and engorgement of veins. They are showing purple and mottled appearance. So what does it do? It will affect the left ovary. It will cause inflammation of three things: the glands, cellular tissue, and it will cause the engorgement of the veins. As a result, there will be purplish and mottled appearance. The concomitants, whenever the patient is having the left ovarian complaint, along with that there will be hot flushes. Since it is during the climacteric period, all the complaints are in the climacteric period, you can write in the concomitants, there will be hot flushes and hot perspiration, extremes of heat and cold with the great debility. Along with menses, there may be hemorrhoids, burning vertex, and headache. So what are all the concomitants? Hot flushes, hot perspiration, extremes of the heat and the cold, that is the extremes of the temperature will cause a great debility. They will be exhausted, they will be tired. Along with the menses, the concomitants of the menses will be hemorrhoids, burning vertex, and headache. Now let us see the menses of Lachesis. The menses will occur at a regular time. So each month regularly the menses will be happening. But the duration of the menses, the period of the flow will be short. The quantity of the flow will be scanty, very less flow. Character of the blood. Blood is dark, watery, and non-coagulable. Modality. All the troubles are relieved by the menstrual flow. Same thing happens in zincum mech, metallicum, lacaninum, magnesium, and phosphorus. Skin complaints of Lachesis. Causation: bad effects of poison, wounds, post-mortem, etc. How does the skin complaints arise from? The bad effects of poison, post-mortem, wounds, etc. When are all the Lachesis is indicated? Which all conditions? During boils, carbuncles, ulcers. We read in the clinicals of Lachesis in the previous video. The same thing in boils, carbuncles, ulcers, etc. with intense pain, dark, bluish or purple colored appearance with a tendency to malignancy. It can be the boils and the carbuncles, the ulcers. The ulcer could be the ulcers have a tendency to become cancerous. They have a tendency to malignancy. The hemorrhages, hot hemorrhages with bloody sweat. So the blood will also be hot. The sweat will be bloody. On the skin, there may be numerous ulcers, gangrene, and pyemic condition. Malignant and asthenic inflammation from which continuous and a profuse blood oozes along with other offensive and ichorous discharges. So guys, there will also be, along with the boils, carbuncles, there will be numerous ulcers, gangrene, that is the death of the tissue, pyemic condition, that is bacterial inflammation of the blood. There will be bacteria in the blood which will bring in infection. Malignant and asthenic inflammation, there will be profuse blood flowing out, and the character of the blood, it will be excoriating and offensive. It will be foul smelling. Look of the skin, bluish purple appearance, boils and carbuncles with a purplish surrounding. The skin is very sensitive to touch. Character of discharge, the discharges are ichorous and offensive. Fever. Lachesis is better indicated in the second and the third week of typhoid with a stupor or muttering delirium. Sunken face, typhoid state, falling of lower jaw, tongue trembles, dry and black, protruded with difficulty and catches between the teeth while protruding. Perspiration is bloody and cold. Stains yellow. So guys, in the Lachesis fever, you have to typically imagine a typhoid fever of second and third stage. The face is swollen, the face is sunken and the jaw is fallen, it is drooping. You see the tongue, it will be dry, it will be black, it will be protruded with a lot of difficulty, trembling. And you see the sweat, it will be bloody and cold, and the sweat will be staining yellow. There may also be hemorrhage from bowels during typhoid fever due to perforation of intestine. Why is there a blood that is blood in the stools. Why is melena present here? It is because of perforation of the intestine. Conjunctiva will be yellow, great physical exhaustion and trembling of whole body, weakness and sinking feeling. With this, we come to an end of the particulars of lachesis. Now we'll see the general modalities. Aggravation is after sleep, abyss, heat in general, extremes of temperature, alcohol, acids, mercury, quinine, pressure or constriction, summer and heat of sun. You can categorize them: heat in general, extremes of temperature, summer, heat of sun. So all temperature and summer and heat in one side. Then you come to the like aversions: alcohol, acids, mercury, quinine, pressure and constriction. Amelioration with the appearance of discharge, like all the menstrual flow will release the complaints as we read earlier. So amelioration with the appearance of discharge and cold application. Relations: the lachesis is complementary to hepar lycopodium nitric acid. In intermittent fever, natrimer follows lachesis when the type changes. The antidotes of lachesis is alum, belladonna, hepar, mercury, nitric acid and nux vomica. With this, we come to an end of lachesis drug picture. If you like my video, hit the like button and subscribe to my channel. Thank you.